Hey, it's Jessica DaMassa with WTF Health. I'm here at HIMSS 19, and joining me right now, we've got a special guest. She was named Entrepreneur by Entrepreneur Magazine, one of the 50 most daring entrepreneurs of 2018. We have my friend Jen Horonjeff, who's the CEO of Savvy Co-op. Jen, so good to have you here.
Thank you so much for having me. I'm excited.
Oh my God, it was like quite an introduction. Whew.
It's a mouthful.
It's a mouthful. Okay, so what is so cool about this, such a great honor to be bestowed upon you, but it's like the awesome part about it is like the recognition that your business is receiving as a result of it, because what you are doing is so different, especially in healthcare. So for those who are not familiar with Savvy Co-op, introduce everybody to it and talk about how you guys are set up.
Yeah, thanks so much for letting us talk about it a little bit. So Savvy Cooperative is actually a co-op. We are collectively owned by patients who are our shareholders, and that's really what we got recognized for, was really changing the power imbalance of what we think about as patients as just consumers and the end user, but we're actually making them our co-owners, because at Savvy we believe that patients have expertise and should be valued the same way as every other stakeholder, and that's really what we're trying to do.
And the way that you guys are doing that, and correct me if I'm wrong, but it's like you're basically integrating, helping other companies in healthcare work with patients to help like drive innovation forward. Is that right?
Absolutely. What we do is help connect companies, researchers, innovators directly with patients so that they can co-design new solutions or get feedback, do user testing, focus groups, interviews. We want to bring the two sides together so we can create more meaningful products that patients will use, that matter to them, that improve outcomes.
This to me, it's one of those things where it's like, it sounds like it should be simple enough if you're in healthcare to like find a patient to get some input on, but it's really not. It's really tricky. And like where I sit in the corner of the world here, talking to different innovators, especially startup companies, a lot of times they have no idea where to begin, or even sometimes large hospital systems. It's like they've got to be very careful in terms of bringing patients in to help kind of, refine maybe a work in progress, or refine like a minimum viable product or things like that. So it's really cool that you've done this and organized it. So I guess talk a little bit too about how you've organized the patients that you're working with that are involved in the co-op.
Yeah, so anybody can join.
Okay.
We really started as advocates ourselves, and that's really my background, is somebody who grew up with chronic illness, was really involved in patient communities. Then became sort of the professional as a human factors engineer and as an academic researcher, and found all these people talking about patients and never talking with them.
Okay.
And so that's what we tried to make that easier. And what we found too is patients never knew about these opportunities. Nobody had ever asked them before. So as a patient advocate, we said, let's bring all these people together. Let's just allow them to more easily find these opportunities. And so anybody can sign up and join. And then every week we post new opportunities. They get posted to sort of a virtual bulletin board, if you will. And patients can opt in to participate. We just try to make it really seamless. So it's almost like the Upworks or TaskRabbit, kind of bringing the gig economy to healthcare. Especially, you talked about startups. And in digital health, there are so many people coming into healthcare from technology, but yet they've never been in healthcare. They've never talked to patients. And honestly, they think that just asking friends and family is good enough. But being somebody with a cancer diagnosis, a diabetes diagnosis, you're just thrusting technology or a new app or a new service at them, that might not be something that integrates into their life. So we actually have to talk to the right patient at the right time, and that's what we're trying to help solve. And we then partner with those advocacy groups or other patient groups to just give them a voice.
Very cool. Now, how do you think, generally speaking, like coming out of, take off your CEO hat for a minute and talk to me about the industry at large, because I love to talk a little bit about trends, and so I'd like to talk about the whole patient-included kind of trend. I mean, it's something that's been going on for a long time, and it feels like just recently it's kind of started to dovetail with the consumerization of healthcare that everybody's been talking about. What are you seeing there? Do you really, sometimes we talk about the consumerization of healthcare, and it's like, yeah, of course it sounds great in theory. Are we really headed in that direction? What do you think, John?
Well, I do think that having, some of the big tech giants that are coming from other consumer markets coming into the space does, push the envelope a little bit different. But the pushback around sort of consumers being the same thing as patients is that sort of implies choice that patients don't always have when it's dictated by their provider or by their health insurance and the whole rigmarole of the system. And so there is a delicate balance there, but we are trying to marry them more and more, and that's hopefully what we're going to start to see.
Is there like another word we can use? Because seriously, because I always think that too. I think it's like, it's not consumerization if I have no choice about where to spend my healthcare dollars. Right. Like there's something else choosing that for me. Yeah. That's not what happens when I go to Target. I wish sometimes that was what would happen. I'd probably buy a lot less. But so I'm curious too to get your perspective, like as far as like think just even that shift in paradigm of starting now, you have these big healthcare companies thinking about the people who are buying their services as consumers instead of patients. Do you think there's a danger there? Like, do we kind of dehumanize? It's like maybe the condition that person might have by calling them a consumer as opposed to a patient. Like sometimes I get a little funny about how those words are now being used interchangeably, because to me they imply different things, right? What are your thoughts on that?
Well, I think words matter, and I do think we need to think about that. I'll tell you one example that we found in some of the user testing that we were helping some companies with, that when they were testing out diabetes products and they were having people like look at their marketing, and they kept calling them diabetics. And people said, I don't want to be called a diabetic. I'm a person with diabetes. And I think that then that's something that, depending on what you're doing, consumer might be the right word, or patient, or person with a disability. So depending on what we do, we need to go deeper. We can't just kind of have an umbrella term for everybody.
Right. Last question for you. I just want to know, as far as moving forward, as like some of these consumer companies do push in more, and as the industry continues to hopefully move in that direction of becoming more consumer friendly, what can companies that are working on innovations do in order to stay mindful about including the person, the consumer, the patient, in their design and in their trajectory moving forward? Other than working with like an organization like yours, but what can they do? Like, what's your best advice? What do people often overlook?
Well, I think, again, in the healthcare ecosystem, we forget all the different stakeholders. And so oftentimes, you might actually have the payer be the one that's paying you, but don't forget who the end user ultimately is. So that's sort of the biggest reminder, is just, I know people can get focused of like, who's going to pay for this, and I'm going to go talk to them. But ultimately in healthcare, we're all here because of patients, and so we need to understand what their needs are. And so you can start doing it just on small little levels, but what we hope is that people will have more and more touch points with patients to get feedback, rather than spending all this time and money creating something that is not going to be useful, doesn't solve real problems.
Creates more friction.
Exactly.
Yeah. All right, Jen. Well, thanks so much for stopping by to weigh in. I love to talk about patients, so we don't get enough of an opportunity to do so. So thanks so much.
Oh, pleasure.
I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.